Good day, everyone. I am Juan Jujilin Dulay.
I am Shania Janelle Empress Doza.
I am Kathleen Grace P. Jimenez.
I am Kimberly Honrado.
Evangeline A. Madriaga.
And I am Shire May Ilaguerta.
And I am Duvi Ilyares.
Today, we are going to discuss to you about chemical barriers and giving you more further information.
So bago nga natin i-explore ang aming topic, narito ang mga intros para sa chemical barriers. First is the overview. Second is the definition. Third, four methods. And fourth, lastly, advantages and disadvantages ng chemical barriers. Okay, so dumapo na po tayo sa aming overview. Chemical barriers. Hormonal methods of birth control uses hormones to regulate or stop ovulation and prevent pregnancy. Ang ovulation pala is the biological process ng ovary which nag-release siya ng egg para sa fertilization process. Mostly, ang ovulation phase is nangyayari sa 14th day after ng menstrual period ng babae. And depending on the type of hormones that are used, these methods can prevent ovulation, weaken cervical mucus, which help block sperm from reaching the egg or thin the lining of the uterus. So, yung purpose pala ng mga hormones is to prevent the egg from releasing in the ovary para hindi siya ma-fertilize ng mga sperm cell and resulting into pregnancy. So, what is chemical contraceptives? Ang chemical contraceptives is available in the form of tablets, spermicidal agents, or creams. They all contain substances called spermicides. Yung spermicides is responsible din siya sa pag-kill ng sperms or at least i-adjust yung ability nila para gumalaw. Para din silang mga hormones pero specific. And also, chemical contraceptives are inserted into the vagina before sexual intercourse. Mostly, ito yung mga spermicidal agents before sexual intercourse. And also, kasama din pala dito yung mga birth control pills para sa prevention ng pregnancy as well. So, ano nga ba yung mga different methods of chemical contraceptives? Nariyan ang first, spermicides, second, pills, and third, uncommon methods ng chemical contraceptives.
Spermicides are detergents that damage the cell membrane of the sperm. This must be placed within the vagina before penile penetration can be effective. It contains chemical to stop sperm from getting into an egg. Ang spermicides ay isang uri ng contraceptive chemical na pinipigil ang mga sperm cells sa pag-abot sa ovum. Bagamat hindi nito aktual na pinapatay ang mga sperm cells, gumagana ang spermicide sa pamamagitan ng pagharang sa pasukan sa ating cervix. Additionally, spermicides are often combined with a barrier method such as condom or diaphragm. When a spermicide is used as the only method of the contraception, the pregnancy rate is 6% in clinical studies, but 26% with typical use. Upang gumana ang spermicides, dapat maglagay ng barrier contraceptives gaya ng condom or birth control sponge. Ngunit may 26% pregnancy rates ito kumpara sa 1% pregnancy rates ng birth control pills kapag ginagamit ito ng maayos. Lastly, spermicides come in several different forms such as cream, gel, foam, film, and suppositories.
I will be discussing about the 6 types of spermicide. We have contraceptive film, spermicidal foam, contraceptive sponge, spermicidal jelly, contraceptive insert, tablets and suppositories, and spermicidal gels and creams. Contraceptive film is a super thin film that is inserted into vagina front hole. It then dissolves and releases nonoxynol 9, a chemical that kills sperm. The film must be used every time you have intercourse in order to prevent pregnancy. Next, we have spermicidal foam. The sponge is a round device that made of soft foam that contains spermicides. It is inserted into the vagina to cover the cervix and keeps sperms from entering the uterus. It also inactivates sperm. The sponge does not protect against the STIs including HIV. The benefits of spermicidal foam: it is effective, convenient, easy to use, and hormone-free. Next, we have contraceptive insert tablets or suppositories. These are solid forms of concentrated spermicide that melt into foam. Insert or suppositories are about 1/2 inch long or less than 1/4 inch wide.
The fourth one is spermicidal jelly. Contraceptive jelly is another form of concentrated spermicide. Jellies come in tubes. They are usually used with a diaphragm or cervical cup. So, ito pong spermicidal jelly ay ginagamit sa pamamagitan ng pag-i-squeeze nito sa isang applicator at pagkatapos ay ini-insert sa vagina ng isang babae. At paalala po, kailangang mag-insert ng second dose if ang sexual intercourse lasts longer than an hour or if you have sex again. And when this used with a diaphragm, ang protection daw po ay naglalast up to 6 hours. At unlike po sa ibang spermicidal like foams, films at iba pa, ang jelly po can also provide lubrication or pagpapadulas kung tawagin. Fifth, spermicidal creams and gels. Creams and gels are used the same way as spermicidal jelly. So kagaya po sa jelly, they also provide lubrication. Contraceptive creams and gels come in different textures. They tend to be less likely to drip or leak than other forms of spermicide. So, sa paraan po ng paggamit nito ay tinitwist siya sa applicator onto the end of the tube. And kapag na-filled na, iti-twist off mo na ang applicator and ready na siya i-insert into the vagina ng babae close to the cervix. So, sinasabi nila na ang mga gels and creams work best when used right before sex. And most daw po should not be more than 15 minutes before sexual intercourse. And the last one is contraceptive sponge. The contraceptive sponge is a soft, round device about 2 inches in diameter. Ito ay made of solid polyurethane foam and contains spermicide. Its sponge has a nylon loop na nagka-attach sa bottom for removal. At sa paraan daw po ng paggamit nito ay need mong i-moisten yung sponge with water and insert it into the vagina before sex. So itong contraceptive sponge po ay nag-work to prevent pregnancy by blocking the cervix and killing the sperm. So now let's move on to the different methods of chemical contraceptives. Contraceptive pills. The birth control pill, also called the pill, is a daily pill that contains hormones to change the way the body works and prevent pregnancy. Type of oral contraception siya that uses hormones to prevent pregnancy. So pag sinabing oral means you take it by mouth. Contraception is any form of birth control, any device or method to prevent pregnancy. So people call it the pill because it comes in pill form that easy to take. Hormones and chemical substances that control the functioning of the body's organ. Kumbaga, yung hormones ay itinuturing na chemical messenger ng ating katawan. In this case, the hormones in the pill control the ovaries and the uterus. Most birth control pills are combination pills containing a mix of hormones estrogen and progesterone to prevent ovulation or the release of an egg during the monthly menstrual cycle. The hormones in contraceptive don't only prevent ovulation. Yung iba po nagkukos sa mucus in the cervix or yung opening of the womb to become thick and sticky, making it harder for the sperm to move and reach the egg cell. So as a result po, pregnancy can happen if a female doesn't ovulate kasi nga po, there is no egg to be fertilized. And now, let's proceed to the two categories of contraceptive pills. The steroidal contraceptives and the non-steroidal contraceptives.
Steroidal contraceptives, also known as oral contraceptives, are a type of birth control that contains the female hormones estrogen and progesterone. These hormones prevent the release of an egg from the ovaries. Steroidal contraceptives can prevent ovulation because it thickens cervical mucus to prevent sperm from reaching the egg, and thin the lining of the uterus to prevent a fertilized egg from implanting. Steroidal contraceptive pills are available in various forms such as tablets and capsules. It is important to note that steroidal contraceptives can have side effects such as weight gain, mood changes, and many more. The side effects depends on your body.
Combined pills prevent pregnancy by stopping ovulation, thickening cervical mucus to impede sperm movement, and thinning the uterine lining to prevent fertilized egg from implanting and growing. While sequential pills have two phases. The first part contains estrogen only, and the second part contains both estrogen and progesterone. Older regimens use high dosage of estrogen alone for 16 days, followed by 15 days of combined estrogen and progesterone, preventing pregnancy with hormones variation.
Ang second type of contraceptive pills is the non-steroidal contraceptives. Ang non-steroidal contraceptives is developed by the Central Drug Research Institute or CDRI. Ang mechanism ito is nag-include sa interfering with the motility of fallopian tube and surpassing corpus luteal function. Yung corpus luteal function is responsible sa pagproduce ng mga hormones like estrogen and progesterone. Ang first and only non-steroidal contraceptive pill is Saheli. Saheli, aka Centroman, is the only non-steroidal pill with zero side effects available in the world. The pill, Saheli, launched by HLL in 1991 in India, is free from side effects like weight gain, nausea, vomiting, and headache. Unlike sa mga steroidal contraceptives na may mga side effects, ang non-steroidal contraceptives is ito yung mga oral contraceptives na walang side effects once na consume ng babae itong contraceptives na to. And ang Saheli pala is na-develop siya sa country ng India. And they are the first na nag-invento ng non-steroidal contraceptive pill sa buong mundo.
So, here's the uncommon methods of chemical contraceptives. So, what is Depo-Provera? So, Depo-Provera is a contraceptives injection that contains the hormone prostogen. Depo-Provera is given as an injection every 3 months. Depo-Provera typically suppresses ovulation, keeping your ovaries from releasing an egg. Depo-Provera, it is also used to prevent pregnancy, or kung ang isang babae ay ayaw manganak, ito yung tinitake nila, and also manage medical condition related to your menstrual cycle. So, ang Depo-Provera ay merong side effects. It is usually decreased or stopped within the first few months. So, here's the side effects of Depo-Provera. They might be include, number 1, abdominal pain. Number 2, bloating. Number 3, depression. And number 4, dizziness.
Hi! Today, we're gonna tackle the advantage and disadvantage of chemical contraceptives. First, we're gonna talk about the advantage of spermicides. Number 1, full personal control over use. The second one is no need for a special procedure or exam. The third one doesn't contain hormones. Number 4, almost available without a prescription and most drugstore relatively inexpensive. If we have advantage, of course, we have the disadvantage. First, need to plan ahead, must have available when you have sex. The second one, must reinsert in every hour. The third one, doesn't provide protection from STDs, not as effective as other method. And number 4, some have allergic or chemical reaction to ingredients in it. The last, side effects may include increased urinary tract infections or irritation. Those are the advantage and disadvantage of chemical contraceptives.
Ano-ano nga po ba yung mga advantages and disadvantages of oral contraceptive pill? Advantages. So, una, highly effective 99%. Syempre, if you use it correctly and perfectly, of course, the pill is 99% effective. Reversible. Contraception can protect you for weeks or months at a time without you having to remember to do anything. Is the menstrual cycle. The pill can make your periods better. Yung hormones po sa pill can also reduce menstrual cramps and make your periods lighter. Also help in skin and hair problems. Clear up skin and prevent unwanted hair growth by reducing the levels of male hormones your ovaries make. Aid in PMS and menstrual migraines. If your migraines is associated with premenstrual syndrome or PMS kung tawagin, you may find that taking the combined oral contraceptive pill ay makakatulong to reduce migraine attacks during the time just before your period. At dumako naman tayo sa ilang halimbawa ng disadvantages ng oral contraceptive pills. First, nariyan ng potential side effects gaya ng breast tenderness, bloating, high blood pressure, at iba pa. Second, does not protect against STIs. The oral contraceptive pill does not prevent a girl from getting an STI or sexually transmitted infections. Kasi nga po, it only works to prevent pregnancy. The only way to protect yourself against most infections na maaring makuha is by using condoms and water-based lubricant. Third, effectiveness can be reduced. The main thing that makes the pill not work is not taking it every day. But other things like vomiting or having diarrhea for more than 48 hours or 2 days may lower how well the pill prevents pregnancy. Must be taken every day at the same time. Skipping or taking the pill more than 5 hours late or missing it entirely can increase your risk of getting pregnant.
The uncommon methods of chemical contraceptives, advantages and disadvantages. Depo-Provera. Ang advantage ng Depo-Provera is highly effective, syempre, discreet and private. Use not linked to coitus and requires user to remember only 4 times a year. So, i-take mo lang itong Depo-Provera ng 4 times a year. However, yung disadvantages naman nito is magkakaroon ka ng weight gain. Impossible to discontinue immediately. Delay return to fertility, adverse effect on lipids, and decrease bone mineral density with long-term use. So, grabe nga yung mga disadvantages nito. Also, yung lipids pala, siya yung responsible sa pag-store ng energy ng katawan natin or sa ating mga cells, ganun. And just like that, it is impossible to discontinue immediately. Kasi nga dumaan siya sa mga prosesong ganyan-ganyan at unti-unti na rin nasana yung katawan natin dahil sa deeper preventer na to. And ano rin ba kaya yung mga advantages and disadvantages ng progestin implants? Ang progestin implants ay yung maliliit na six sticks like that. Basta, yun. Ang advantages niya is highly effective din pagdating sa contraceptives and eliminate user error. Pwede siya maging long-term at reversible. However, yung disadvantages nito is high initial cost. Mahal din ito. Insertion and removal requires specified training. So, para rin siyang, may related sa surgical methods, something like that. And lastly, cannot be easily discontinued. Kaya nang sinabi natin doon sa Depo Provera, mahirap din siyang i-discontinue kasi yung mga surgical na pinagdaanan ng isang tao para dyan is mahirap din kasi unti-unti rin nasana yung katawan nila para dyan sa mga implants na iyan.
So here's our reference for this topic. Thank you for watching.